Today, I want to show you how to stretch for sciatic pain. Almost everybody knows what sciatic pain is. The name itself literally means pain along the sciatic nerve. Story time. My mom had sciatic pain a couple years ago. She told me she had pain down her right leg that gets worse when she sits for more than a couple minutes. This was very debilitating for her because it restricted her ability to drive. As I examined her, she had no pain in her lower back, so I initially thought she had piriformis syndrome, which is a condition when the piriformis muscle of the hip puts pressure over the sciatic nerve. As I examined her leg, however, I found that her hip as well as her entire back was very flexible. Her piriformis was also not tender to the touch. So this points us back to the lower back. Her case was very confusing because she did not have tenderness in either her hip, where her piriformis was, or her lower back. We later found out through an x-ray that she had bone spurs in her lumbar spine. After a long time, we were able to resolve her symptoms through some extension exercises such as prolonged elbow stretch as well as the Cobra Stretch. In this video, I will demonstrate how to do these exercises, and after I do that, I will show you how to stretch for piriformis syndrome as well. To do the prolonged elbows exercise, you can start by lying down on your stomach, and then prop your upper body up with your forearms and elbows, and stay in this position as relaxed as you can for a few seconds, and then come back down to the floor to rest. And repeat this exercise for 5 repetitions at least once a day. And you can do more if you feel like this exercise helps, or if this exercise doesn't make your symptoms worse. Please note that if you have any inflammation or swelling in your lower back, any stretch for your lower back will be painful, and make sure to ice the area for 15 to 20 minutes before you attempt these stretches. If the area doesn't feel tender to the touch or swollen, but it feels extremely stiff, which most people are first thing they wake up in the morning, in this case, it is a good idea to warm up the area by using a heating pad for, again, 15 to 20 minutes before you do these stretches. Taking a hot shower will also do the trick. To do the Cobra Stretch, we also start by lying down on your stomach, like the prolonged elbow stretch. Prop your upper body up with your arms, but keep your hips on the floor. Stay in this position for a couple seconds, and then come down to the floor to rest. Repeat for 5 repetitions at least once a day. Again, you can do more if you feel like this is helping, or if this doesn't increase your symptoms. Since I mentioned piriformis syndrome earlier, I will also show you how to stretch for it. I had a patient who fell and landed on her hip. The inflammation in her hip ended up creating scar tissue around her piriformis and sciatic nerve. She felt relief when she did child pose stretch, which stretches her lower back as well as her hip. For people with piriformis syndrome, I recommend 3 stretches: the gluteus stretch, the hamstring stretch, and most important of all, the piriformis stretch. To do the glute stretch, I recommend lying down on your back and the knee of the affected leg. Use your hands to pull that knee across toward the opposite shoulder. Pull that knee toward the shoulder on the opposite side of the affected leg. Hold the stretch for as long as you could tolerate and repeat for 3 sets. To do hamstring stretch for piriformis syndrome, I recommend a dynamic stretch over a static stretch, because holding a static stretch might increase your sciatic symptoms and it could be very painful. While dynamic stretch works better for warming up the muscles and loosening up the muscles and the structures around it. For dynamic stretch of the hamstring muscles, I recommend using a stretching strap. So we're going to use a stretching strap to hook your foot, and we're going to use the strap to lift the leg up to the ceiling. Now you could do the stretch in a seated or supine, lying down position. Let's start with lying down. So you secure the strap around your foot. You pull the strap to help lift your foot up to the ceiling until you feel a stretch behind your knee and thigh. We're not holding the stretch because it's a dynamic stretch. So we feel the stretch, then you bend your knee. And then you bring it up again using the help of the strap, and you bend the knee again. Repeat for 10 repetitions for 3 sets. Now if this is too easy for you, you can attempt a little bit of a static stretch by holding the stretch at the top. To do the same stretch in a seated position, you can start by sitting on a chair. Again, secure the strap around your foot, and you pull the strap to assist lifting the foot up toward the ceiling until you feel the stretch behind your knee and thigh. For dynamic stretch, again repeat for 10 repetitions for 3 sets. To do the piriformis stretch, you could start either from the seated position or lying down on your back. To stretch your piriformis lying down, lie down on your back, bend both knees with feet flat on the floor. Bring the ankle of the affected leg over to rest on the knee of the other leg. If you feel a stretch in your piriformis and the hip at this point, you could start to push the knee of the affected leg with your hand and do a little push and release to loosen up that piriformis. Do this for 10 repetitions. If you don't feel a stretch at this point, use both hands, pull the thigh of the unaffected leg toward your chest. Hold the stretch for a couple seconds and rest. Repeat for 3 sets. To do the piriformis stretch in the seated position, sit with an upright posture in the chair. Put the ankle of the affected leg on top of the knee of the unaffected leg. If you feel a stretch at this point, you could push down on the knee of the affected leg with your hand and do a bit of push and release. Do this for 10 repetitions to loosen up the piriformis muscle. If you don't feel a stretch at all in this point, push the knee of the affected leg down with your elbow. Grab the ankle of the affected leg, hinge forward with your hip until you feel a stretch in your piriformis muscle. Hold the stretch for a couple seconds, put your leg down to rest. Repeat for 3 sets. There is another way to stretch the piriformis muscle in a seated position. You can do this on a bed or on a couch. Make sure the knee of the affected leg is flexed and the hip of the affected leg is externally rotated so that the outside of the knee is rested on a supporting surface. Hinge forward at the hip to increase the stretch. Hold for a few seconds and then rest. Repeat for 3 sets. You could also do the same stretch on the floor if you could tolerate it. Piriformis syndrome is very hard to rehab from because the exercises are quite painful. However, if you know the piriformis muscle is the culprit, it is well worth the pain to stretch it out. Sometimes the scar tissue around the piriformis muscle gets stuck to the sciatic nerve to the point that it doesn't release even when you stretch. In this situation, you may have to massage it out. The simplest way to massage your piriformis is using a foam roller. And I demonstrated how to do this in my other video called How to Massage the Hip for Hip Pain. I'll leave the link down below, so go check it out after you finish this video. I want to talk about one more possible cause of sciatic pain, which is disc injury. Disc injury in the lower back could cause sciatic symptoms as well. This happens when the injured disc pinches the nerve roots of the spine that contribute to the sciatic nerve. Most common disc injuries that I see are from lifting injuries. This type of injury tends to injure the posterior portion of the lumbar disc. So when this happens, you will typically have more pain when you bend forward and less pain when you bend backwards. In this situation, you might be able to reduce your sciatic symptoms with extension exercises like prone elbow stretch and the Cobra Stretch like we talked about before. However, if you have increased pain both bending forward and bending backward, there is a chance that your disc is injured both in the front and in the back. In this situation, it is best to avoid both bending forward and bending backward until the pain decreases. And in this situation, it is better to do lumbar traction exercises and work on increasing your core strength and core endurance at the same time. With any injuries, please consult with your local physical therapist regarding exercises that are appropriate for you. Your local physical therapist should be able to assess you correctly and tailor the exercises according to your specific injury. I demonstrated some lumbar traction exercises that I personally like in my video, How to Stretch for Low Back Pain. I will leave the link of that video down below as well. I will end the video by showing you my go-to exercises for increasing core strength and core endurance. For increasing core strength, I like supine heel taps with transverse abdominis activation. To do supine heel taps, lie down on your back on the floor. I start by contracting my transversus abdominis muscle by drawing my belly button away from my fingers and into the spine. This is a slight contraction, and I'll keep the tension in my abdominals to keep my hips and knees flexed at 90 degrees. I lower my heels one at a time to touch the floor. I alternate the right and left leg while keeping my core engaged so I don't arch my back. Try to do 10 repetitions of this exercise. Rest and repeat this exercise for 3 sets. To increase my core endurance, I like to do planks and side planks. To do a plank exercise, I start in my hands and knees position. I bring my elbows down to the floor, and then I straighten my hips and knees. I tighten my core muscles to keep my back straight. I hold this position for as long as I can without shaking and without increased pain. And then I bring my knees down to the floor to rest. Make sure you keep breathing throughout these exercises. Please do not try to force yourself to hold the plank positions when your muscles are tired, especially when you have a back injury. Now repeat this exercise for 3 sets. For side plank, I went over this exercise just last week in my video, How to Strengthen the Hip for Hip Pain. In that video, I went over 3 different variations of side planks that you could try. I'll leave the link down below. If you find that this video has helped you in any way, please give it a like. It will really help with the YouTube algorithm.